Something we hear all the time from our clients, specifically periodontists and oral surgeons, is the fact that you don't want price shoppers. We don't want to advertise the price shoppers. I don't want price shoppers calling us. I don't want people calling us thinking that we're going to be the cheapest in town, talking about money, money, money. They don't see the value, and it goes on and on and on and on and on. I'm Bart Nellinger. This is Progressive Dental Marketing, and I'm going to tell you why you can't close price shoppers. One of the biggest misconceptions that we hear when we're advertising dental implants for our clients, which over 60% are specialists, periodontists and oral surgeons, one of the biggest misconceptions we hear is that we don't want price shoppers, or price shoppers aren't qualified, or they're cheap, or whatever it is, but it's almost always negative. And the reality is that price shoppers that are almost the easiest ones to close. Not for periodontists and oral surgeons, because you guys are used to getting referred patients that are already teed up. They've already been going to a dentist for 10, 15, 20 years. They tell them to go and they're pre-sold. You're right, it doesn't get any easier than that. But as far as advertising direct to the public in the dental implant market, dealing with price shoppers is it's just a reality. If you're not dealing with any price shoppers, then you're probably not getting very many leads, you're not doing very many arches. So to deal with them is a must, and that's going to be obvious. But here's the problem. The reason why we can't close is because there's been no training and there's no good idea in terms of how to negotiate with these people and understanding their psychology. Why are they price shopping? They're not price shopping necessarily because they're cheap. How are they supposed to know what an arch is going to cost? Put yourself in their shoes. Most of these people have terminal dentition. They haven't been to the dentist in 10, 15, 20 years sometimes. They show up and they're told all their teeth have to come out. They need a full arch of implants, and it's going to cost them 30 grand per arch, 60,000. So how do they know if 30 grand an arch is high, or is it low? Is it in the middle? How are they supposed to know if they're making a smart purchase or they're getting the best bang for the buck? That's all they're trying to do. That's it, right? People that are calling in specifically shopping price, the upside to it is that they already have urgency. They already know they need the treatment. They've already decided on getting it. They're just trying to figure out what the fair market value is and how low they can get it for, which is exactly what you guys do when you're a consumer. When you're buying a house or you're buying a car or you're buying advertising from me, you're constantly doing the same exact thing. It's called being a consumer, right? And when you're in a competitive situation, you have to understand how to negotiate. And one of the things that we go through and we talk about all the time, especially with our surgeons, because you're not used to this type of negotiation until you go direct to the public, that will reveal your weaknesses extremely fast. Trust me, the second you start marketing direct to the public, you're going to figure out what you're made of. You're going to be one of those doctors that says, the leads suck, or you're going to be one of those doctors that does the 20, 25, 30 arches a month, one of the two. There's very few that are in between. But one of the things that we talk about all the time is starting off the negotiation. The reason why you can't close price shoppers is because you don't show them literally how they're getting a great deal. By using numbers. We don't show them the numbers. Nobody wants to pay retail. Certainly nobody wants to pay over retail, but no one even wants to pay retail. And a consumer mindset is always telling people the more money that I spend, the more concessions you should make. Right, wrong, or indifferent, it doesn't matter. That is the consumer mindset. So somebody thinks if they're going to come in and drop $50,000 with you or $60,000 with you, they should get some concessions. And if they don't see any concessions, all they see is retail. The reality of it is most of my surgeons, they already give great deals. They just don't show anybody. They just show them one price. Imagine going out and buying a Mercedes S550. Are you going to pay the price that's on the sticker on the window? Are you going to pay MSRP? What is the point of them putting an MSRP on the car in the first place, right? To state a baseline for what it's worth. Most of my clients, they're giving great deals all over the place, but then they still only give them one price. They bundle everything and they say it's going to be $27,000. No, okay, then that's the starting point for negotiation. The problem is they've already bundled everything and already given a great price. It's just not the perception. So you're in a very weak position when it comes to negotiating. So what we like to do is take whatever you're doing. If you're selling for $27,000, you need to be able to show people what its true value is, how it's really worth $35. And you need to sell it at the $35 and then show them they're getting a 5 or a 6 or a 7 or an 8 or a 9 or a $10,000 discount, wherever you want to end up. You want to start the negotiation off, because if you don't understand, it's a super competitive market, and when they look at you and go, okay, you know what, everything sounds so good, you were so nice, I really think I'm going to do it. How about this? Let me go home, let me think about it, let me talk to my wife, let me talk to my husband, and I'll get back with you like Tuesday or Wednesday, okay? When they say that in their head, they're going to go get another treatment plan, and they're going to look for a better deal, because they don't think they're getting a good deal. They think they're paying retail with you. That's the biggest problem. And we have to understand that they are consumers, and that thought process, it doesn't make them cheap. It doesn't make them unqualified. Certainly plenty of them are going to be unqualified, but it doesn't make them all unqualified. And it's something that I'll take price shoppers every day of the week. Give me somebody calling in and asking how much you charge for a website. I'll take that every day. Why? Because if they're calling me, they're already they've got problems. They're not complacent. They have to move. They know they have to do something. So it's an easy close. They're called buying questions for a reason. How much is a buying question? You want that. But also recognize in the world of dentistry, we don't really have sales training. We don't have any resources for you guys to send your treatment coordinators to learn how to triage, how to pre-qualify, how to close price shoppers, how to overcome objections, how to create a really awesome experience for direct-to-public patients, and how to save you as the doctor time, energy, and effort, so that you're in the operatory doing more surgeries, helping more people. So that's why you can't close price shoppers, because you don't know how to negotiate, you don't know how to position your services or your products in a light that shows the patient in a straightforward, logical manner that they're getting an amazing deal. And that's what you want them to feel like. You want them to feel like they want the clinical outcome, like it's going to change their life, they like you, they trust you, and they feel like they're getting a fabulous deal, like they feel really, really good about the money that they've spent. And that's it. So you want to close price shoppers, you want to do a lot of arches, you have to learn a little bit about the art of negotiation.